some of the things that we've already heard. Dean was talking this morning, Dean Ferguson, about places where patients could be involved. And I just want to illustrate that I probably have hit all except for the governance one that he raised. So some of the things I've done is I've been a member of the Research Management Committee of the Canadian Frailty Network since 2011 for about 3.5 years. I was doing that as one of 2 citizen members. We set priorities for research, so I've been involved in the research priority setting and felt that I helped to move the needle where we really looked at a good focus on home care, which I think is very important, and took a little bit less of the focus entirely off the ICU. So we balanced it out a bit more. And then we evaluated the grant applications that came our way, and boy did I learn a lot. I've read literally hundreds of grant applications. When I started, I did not know that a PI stood for Principal Investigator, so I had a huge learning loop. I'm part of a group that's providing advice on patient-oriented research and how to engage with patients, and that group is the board of PERC, the Patient Engagement Resource Center for Primary Care Research. I've led some research too, even though I know nothing about research. I mean, I have a BA in history, French literature, for whatever that's worth, but I don't have any experience in health research at least I didn't when I started this project. It was funded by OSU through Patients Canada, and there were 4 of us, and we looked at what the experience was of being a patient partner in research. It was an observational study, a little bit of navel gazing, if you will. We had all been sort of just jumped into various different research projects, all of us more than one. And it was new to us, it was new to our partners, and we thought, gosh, how do we do this? What can we learn from this? So we met about once a month, and we'd have a little round table, and we'd say, oh, I ran into this. Did you run into this? What do I do about that? And so we were both a sort of, if you will, self-help group, but we also made some fairly detailed notes about what we were experiencing as new patient partners in research. It was a really interesting experience. Then I discovered the PACER program, which is the Patient and Community Engagement Research Program out of the University of Calgary. Myself and 2 other colleagues who are patients and caregivers decided to take the very first effort they made to do it long distance. So in spite of our terrible technology issues, we managed to do it, and as part of that project, or part of that study, we had to come up with our own research question, do our own research. We had to get a research sponsor. We were sponsored by St. Elizabeth Healthcare, who were terrific. And we looked at examining and understanding the impact of illness and injury on couples. So, and we published it through St. Elizabeth. Sorry. And the other thing that I've done, again, with Sarah is I've been trained as a CIHR SCORE trainer. And so I've done a certain amount of training about patient and family engagement in research. And Sarah and I will be doing the workshop later this afternoon. Next slide. Are we there? Okay. So now I'm going to tell you a little bit more detail about some of the things that I've done. I decided to pick 2 things where I felt I had made an impact as a patient partner. So I'm going to tell 2 stories. And the first one, when I was on the Research Management Committee, which was early in my foray into the world of research, we were looking at a particular grant application for some drug trial, randomized control trial. So I learned a little bit about those. And my 17 professional colleagues around the table said, great team. I couldn't comment on that because I didn't know anybody. Great method. I couldn't comment on that because what did I know about research methods? Certainly not at that time. Great control list. They've listed all the right medications. Couldn't comment on that particularly. Didn't know much about the medications. So I thought about what can I contribute? And I thought, well, I can always ask the the questions. And so I asked them, well, why on the control list there are only prescribed medicines and there's nothing like St. John's warts? And there was just this like really pregnant pause around the table. And then we quietly moved on to the next application. And I was surprised. I didn't know much about St. John's warts. I went and Googled it later and discovered it actually has some very significant side effects when it combines with prescription medications. Who knew? Certainly I didn't. I just asked the question. But I think we bring an outside perspective. We're able to blow out of the silos because we don't live in the silos. And I thought that I helped bring some value to that little exercise. The second story I'd like to tell you about is the Prom Ed project. And this is a project that started over a cup of coffee. I don't know how he got my name, but Dr. Sam Vaillancourt asked if he could have a coffee with me. He wanted to run some ideas by me. So we had coffee at the Lee Kashim Institute. He bought me the coffee. It was very nice. And we just had this most amazing conversation.